Welcome to our Posh podcast. You guys are in for a treat today. This is Gabrielle. I'm your co-host today with my daughter Marcella.
Hello.
And our Puerto Rican Bernie is here with us.
Hello, 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 hola.
And guys, it's Spider's birthday today.
What?
Happy birthday.
Yeah. That's
What
a
up,
sexy
y'all?
birthday. How old are you, man?
40 years old. That's
40?
why I said us guys in our 40s.
Oh,
Remember
you're
PM
kinda
Dawn.
like baby 40.
Yeah.
Baby.
I mean, you're 40. That's fine. 40's not bad. 40 wasn't bad for me. Like, I mean...
Bernie, hold on.
was-
We're announcing our guest.
Oh,
Oh my
right.
God.
Sorry, I
I
forgot
was
about you.
listening.
I got excited about the 40-year-old thing. Right
No,
there.
I am telling you, I don't care. We have over 200 shows today. Is the most amazing guest
For many
that we
reasons.
have.
That's a
For
lot.
many
on-
reasons.
Don't be
Dr.
nervous.
Curtis Crane.
You can't be nervous.
Dr. Curtis Crane is here, and he drove in town from Austin. He's our first out-of-town
This
guest,
is
number
good.
one. We took him out to dinner yesterday, and then he came to our house.
Was there
And
like a
I'm
story
gonna-
with the dinner part? Because you seem to
I am
pause
gonna
after
tell you,
took dinner.
You go through life, and I said we're not talking about age, but I'm older, and you go through life, and you think, like, you wonder about certain things, and you think certain things, and you're not quite sure how you should think, and then you meet someone like Curtis,
Aw.
and he changed my entire life of something that I am still flabbergasted. I couldn't even sleep. It was just unbelievable.
They said that
Wow.
That's legit.
how you were
That's good.
talking.
No, it's
crying
true.
for you.
It is so true. And I'm going to just tell you right off the bat, Dr. Curtis Crane, I'm going to just have to read to you, first of all, who he is and what he does. I'm going to try and make it short because it's really long. He does a lot of amazing things. But he is a board-certified plastic surgeon and leading sex reassignment surgery specialist. And you have a clinic in Austin and a clinic in San Francisco. He is actually one of the only people in the entire world that is a plastic surgeon and oh God, now I can't find it. I have all this stuff. Reconstructive urologist surgeon. Is that correct? Am I saying that right?
That's correct.
That's impressive.
Thanks.
So plastic surgery, reconstructive urology, and transgender surgery.
So where'd you do your residency at?
Yeah, tell
Well,
us
I
all
did.
that
I did
first.
2 residencies and 2 fellowships, which is very
Wow.
abnormal. Most people
Very.
do a residency and they're done.
Yeah.
And that was not my plan. It just happened that way.
So I'm familiar with that. I've been in orthopedics since 2008.
Right.
So I work for a big medical device orthopedic thing. So the reason I say that is because that's not the norm in any form or fashion. I know that. So 2 residencies, a fellowship's kind of like, that's super specialized, but 2 residencies and 2 fellowships is insane.
Yeah. Thanks.
Yeah, really. No, that's legit.
Yeah. It definitely wasn't the plan. It just sort of kept happening.
That's crazy.
Thank you. Yeah. At one point, I mentioned my dad. I was like, I had done 2 residencies and a fellowship, and I was about 10 years into training. And I mentioned,
What was your fellowship in?
Well, I did a
First
fellowship in urology.
Okay.
So I did urology. That was 6 years.
Yep.
And then I did a fellowship in reconstructive urology in Detroit. The urology residency was at Dartmouth.
Okay. Wow.
Then reconstructive urology in Detroit at Detroit Receiving Hospital. It was trauma and reconstructive urology. So like a lot of gunshot wounds
Yeah.
too. You know, if someone gets ventilated with 15 bullets, the likelihood one of them is going to hit the GU tract is actually pretty reasonable. So
Yeah.
it's gunshot wounds, the kidneys, ureters, bladder. The ureter is just like this tiny little tube that connects the kidney to the bladder. And I had a gunshot wound to the ureter. Like, that's very special. And
You had a gunshot wound to the ureter?
I had to take care of it.
Okay, I was like,
yeah.
yeah. I've had a gunshot wound to the hand, but not to the ureter.
Right,
I'm glad
the
it didn't
ureter.
go that right.
No, yeah, it's suboptimal. So
Dude, that's insane.
it was crazy. Yeah. And so then went to San Antonio, did 3 years of plastic surgery with a focus on microsurgery.
Who did you do your fellowship? Who was your who's your attendant? Like, who was the director of that fellowship?
Dr. Wang, Howard Wang.
Wow.
Yeah. And then after that, did a transgender surgery fellowship in Europe.
Okay. Walk me
Wow.
through that part. So, because I understand the fellowship, I really do grasp that. I understand, it's specialized. It's because it brings you in as separating yourself from a regular orthopedist or plastic surgeon or just in your field. How did you go down that route? Because that is, as we know, so specialized. Right now, I'm excited about this because no one really knows much about it. I was talking to a girlfriend of mine before telling her that we were talking to you, and we started having this conversation about, how do you do it? And what's this? And so it's so specialized. I'm like, how did you even follow down that rabbit hole? Because that's insane in a good way.
Well, thank you. I appreciate it. Yeah, I mean, it was pretty circuitous and totally unplanned. I think probably the best things in life are. And it was a situation where, I got in urology residency at Dartmouth, very prestigious. And I felt like I almost got fired a lot. Never for like bad patient care, but I got marked down for professionalism every evaluation. Yeah. Sorry about that, Dr. Ann Gormley. She's my residency director. But just little things here and there. I remember, you're up late at night, right?
Yeah.
You're doing a lot of work. And I remember one time I got a call at like midnight from a patient, and she says, "Hey, I think I'm allergic to my ditropin, which we put patients on if they have an overactive bladder." And I said, "Oh, are you breathing?" And she said, "Yes." Clearly she was speaking. And I was like, "Okay, what's your allergic reaction?" "I'm getting a rash." I'm like, "Okay, well, as long as you don't have trouble breathing, you're probably going to be all right." I would stop taking it is my medical advice. And I'm glad we could clear this up at 1 a.m. or whenever it was.
That's right.
And she said, "Well, what am I supposed to do with all this ditropin?" And it's just, I don't abide by too many societal norms, right? And she asked me a question, and I said, "I don't know. You could sell it on eBay." And I was giving her options. I'm sure there's legal issues with that, but she asked me a question, and so I gave her an option to consider.
That's so funny.
It's like, I'm not telling you to do it, that this is one scenario. And so I remember the next morning, first thing in the morning, got called into Dr. Gormley's office. She said, "Are you suggesting to patients that they sell their medication?" And I'm like, it wasn't a suggestion. It wasn't a recommendation. It was just a possibility. And I think there's a big difference between
Dude, that was so awesome how you skated that fine line. But I mean, you technically could go sit in the CEO's office and sit in his desk, put your feet up if you wanted to, but it's probably, just saying you could.
It's probably not a good career move,
not, but you could.
It's an option. Yeah. So it was a lot of that stuff. And then I got involved in throwing these insane slip and slide parties where me and my friends would build a 220-foot long slip and slide that was 20 feet wide. Because I lived in Vermont, worked in New Hampshire, and I lived on this acre with a huge slope down, and someone would always go to the ER from one of those slip and slide parties. Like 200 people would come over, and it was mass hysteria. I know there's pictures on Facebook or something, but
we will find those pictures.
We'll find those. And then got into demolition derbies.
What?
Hell yeah.
Yeah, I mean, there's not a lot to do in Vermont.
Dude,
you got to make your own
legit.
fun. It's cool, yeah, but then you develop these extracurricular activities, and there's all these opportunities to possibly get fired from residency. So, point of all this
so funny.
Is when I graduated, I had multiple people come up to me and say, "We can't believe you finished." And so extra training, the whole point of this story is extra training was not on my list.
Yeah.
You need letters of recommendation, and you need all these things. And I wasn't sure that was going to be a possibility. So I got interested in transgender surgery from traveling to Serbia and an experience there, and talked a lot about that, and was told, that's not bread and butter urology. That's not our focus here. Do that later, which is reasonable. And so my plan was just to travel around the world. And
how'd you get to Serbia? Was that just a vacation? Was that a trip? Were you going for a lecture? Were you going for a talk?
I've always been interested in helping underprivileged patients all over the world. I did a bunch of surgeries in Mabani Government Hospital in Swaziland.
Wow.
Was there for a month, and surgeries in Southeast Asia. I really hate it when people don't have anyone to help them.
Yeah.
Which is one of my draws. All this is like 2004, 2005.
Wow.
When no one was talking about the trans community.
Yeah.
And so they didn't have anyone to help them, just like patients in developing countries. That's the commonality here, is I wanted to help people that didn't have anyone else to help them.
It's interesting you say that. Not just to highlight that. Nowadays when we think of these medical missions trips and whatnot, we think, and it's true, the medical mission trips where you deal with pediatrics and whatnot, those are very real needs, right?
Oh,
but
yeah.
you're hitting the nail on the head that people aren't even thinking about the needs of someone in the transgender community, someone who there's no booklet on how do I go about this. They don't even know which way to go to start the process of trying to get help. And it's a real battle for them internally. And I know you clearly know that. I'm just acknowledging that.
That's right. It's not, at the time, it wasn't on anyone's radar. And, imagine being a patient that lives in a country with one of the best medical healthcare systems in the world, but no one wants to help you.
Yeah.
That sucks.
Yeah.
So, went to Belgrade, Serbia.
Plus there's, because at the beginning, it's very scary to even acknowledge that, for someone to talk about that.
Yeah.
So the fear, not even nowhere to go and fearful to talk about it. Now more people, it's open. People are talking about it.
Right.
But when you started in 04, 05, 06, that's like, there's that fear of coming out or even talking about it. So that's cool. Sorry, I got to highlight all this stuff. At least I can grasp the acknowledgement.
You're
of
the
that
good hype guy.
part.
Can we just walk around together the rest of the weekend? I walk by a group and they're like, hey, I just want to draw attention to his shoes. Have you seen this? Like, no one's wearing those shoes. In 10 years, people will, but right now he's doing it. Look at him.
That's true, actually.
I'm the hype guy. I'll be there for sure.
And by the way, my shoes suck.
I was kind of looking. I was like, let me see these shoes.
Yeah, they're torn up Toms.
I'm in workout clothes. It's fine. So continue. So no one has help. You're helping them out.
Yeah, and so that was my plan. I was just gonna travel around the world as a urologist and see who would teach me transgender surgery, so I could help the trans community all over the world and in the U.S. everywhere. And so. This is crazy. I wish I could know the name of this kid, but he changed my life. Every year there's a new residency team that comes in, right? New medical students that are coming in. And so every year you have to interview for the next group of students coming in. And so there's this African-American guy. I can picture him. I have no idea what his name is. Coming to New Hampshire, coming to Dartmouth. And my co-resident, this guy, Kwabena Pobi, we called him the Prince of Ghana. He was African. People would call him African-American in New Hampshire, and I'm like, he's pretty much African. His name's Kwabena Pobi, and he came from Ghana. Yeah, I know to you, black means African-American, but there are some black people that are just African. That exists.
That does exist.
Yeah, but that's New Hampshire, and so
that's so funny, man.
Yeah, and so I pull this guy aside and I go, hey, where are you in from? And he goes, Detroit. And I go, I just want, you seem like a nice kid. I just want you to know that if you came here, then there'd be 2 black guys in New Hampshire. And you should just think about that, because I want you to have fun in life, and maybe that is good for you and maybe it isn't. I don't know, but I'm just pointing that out.
God, that's so funny.
Yeah, so I get to talking to him. Hey, you're from Detroit? And he goes, yeah. And I go, which program are you at? And he said, Wayne State. And I go, oh. 5 years ago, I went to medical school with this guy, Josh Broghammer. And I'm pretty sure he went to urology at Wayne State. And he goes, he's my chief resident.
Oh, shit.
And I go, no shit. I haven't even thought of Broghammer in years. I go, do you have his pager number? And he goes, yeah. And I go, let's prank him.
Oh, that's just awesome.
Yeah. And so I get him out of the interview. We're all like in this library. I go, let's go.
So y'all don't understand. I know you're sorry. I have to acknowledge this because I work in orthopedics and I work around a lot of there's some really cool physicians that are cool. And I know I don't even say it, he says it, but there are some physicians that are just not like this. So in an interview process,
people that should be fired in residency.
An interview process for you to take someone who's applying for him to go this about is not the norm in a good way. That's so cool.
Well, thank you.
So fucking cool.
It's one of the many stories of doing inappropriate things on applicant interview day. But anyway, I'm like, let's get out of here. And he looks at me and he goes, well, I got an interview. I go, well, you can't make this prank phone call in here. So I take him to the call room and we dial Broghammer's number and he calls and I pick up the phone and I go, Hello, this is Dr. Hemmingsworth from Northern Michigan County ER. Is this Dr. Brookhammer? And he says, yeah. And I go, yeah, I have a interesting case I need to transfer to your academic institution.
Oh my God.
Oh my
And he goes, what's that? And I go, well, it's really curious. These two babies were Siamese twins, and they were joined at the foreskin.
God. At the foreskin?
Yeah, they were.
Holy shit.
They were joined at the foreskin, and they just fell apart. And the mother would like them reattached because it's harder to keep control of them when they're not joined at the foreskin.
What is the resident? What is he doing?
He's losing his shit.
Oh my God.
And no kidding, I hadn't talked to Josh in 5 years, and he pauses and he goes, "Is this Kurt?"
Dude, are you serious? Dude, that is so funny. Like in no parallel universe with that conversation I've ever happened before. That's what makes it so funny.
It was so funny. And the reason why this applicant changed my life and why this phone call changed my life is because we chatted. We were caught up on our 5 years, and I go, "What are you doing?" He goes, "Oh, I'm doing a fellowship with Hunter Wessels in Seattle." And I go, "Wow. What's that a fellowship in?" And he said reconstructive urology. And I go, "What's that?" He goes, "You don't know what reconstructive urology is?" And I go, "Nope, I didn't read that chapter." And
It's a new one.
Yeah. And he tells me that I didn't know there were fellowships in this thing.
Yeah.
And he goes, "What are you going to do?" And I go, "I don't know. I'm going to travel around the world and learn transgender surgery." And he said, "You should talk to my residency director, Dr. Santucci." And I said, "Why would I talk to him?" And he said, "Well, because he's a very creative guy. He's good at putting stuff together, helping people out." And I said, "Well, I don't know that I need that." I absolutely did. I just didn't realize it at the time.
Sure.
And he said, "Well, you should just talk to him. Maybe apply to his fellowship." I said, "Josh, I'm not fellowship material. I am going to be super happy. Just finished residency, and there's
just want to finish.
Yeah,
just want to finish.
Not going to be anything else for me in training wise." And so he goes, "No, just talk to him." And I go, "Okay, fine." So I called Dr. Santucci, and he is this super charismatic, interesting guy, like academic powerhouse, published 200 times.
Wow.
He's now my employee.
No.
Wow.
Yeah.
What?
He joined
Just
my
talking
practice.
to you and you saying that because, I mean, there's got to be such an organic connection there.
I respect this guy so much. He's so incredible. He listens to my story, and he goes, "You should go see my friend Miroslav Georgievec in Belgrade, Serbia." And I go, "Oh yeah, Miro, I've already worked with him. I went there a few years ago." And he just pauses. He goes, You went to Serbia?" And I go, "Yeah, I told you I want to learn transgender surgery." And he goes, "You should apply for my fellowship." And I immediately thought, man, who in this program was going to write me a letter of recommendation? I go, I don't think I should apply. And he said, "No, I think you should." And I said, "I don't know."
Dude, that's insane.
Like he's telling me to apply to his fellowship, and I'm being such an idiot. And then he gets my email. Later he sends me an email. He goes, "Hey, are you going to apply or not?" I'm interviewing, and it dawns on me like this world-renowned guy is telling me to apply for his fellowship, and I go, "Well, yeah, okay, I'm going to fly there. I'm going to apply to your fellowship." So he goes, "Okay, fly in this day, rent a car, come to my house, we'll have dinner, and then the next day, I'll take you to the hospital and all this stuff." So in my possibly undeveloped frontal lobe, I'm like, well, it sounds like the first thing is pretty casual, even though I'm meeting my possible fellowship director for the first time.
Dude, that's so insane.
I land in Detroit. I'm wearing like my shittiest jeans. Yeah. Like these Birkenstocks with no socks. And to this day, I only wear socks when I snowboard. Like there were holes in my jeans. I'm pretty sure there were grass stains on them. A t-shirt. And I get in a car. I drive to his house. He opens the door and he goes, "Kurt." And I go, "Hey." I shake his hand. I walk in. He goes, "Oh, can you take off your shoes?" And I go, "Sure." And I take off my shoes, and I'm not wearing socks. And he looks at me and he goes, "Wow, I thought I was casual."
Oh, that's so funny, man.
Yeah. And I go, and then it dawns on me like probably a lot of people would have worn a suit to this.
For sure. Yes, for sure. That's what's so amazing of like this crazy organic, obviously, connection. He's basically telling you just apply, fucking apply. You don't need a letter of recommendation. He's a decision maker.
So that's what I did, and I didn't wear socks. And so, yeah, and I'm like, I think I said to him, I'm like, yeah, I probably could have worn a suit. I just got off this plane though. As though those two are mutually exclusive.
Oh my God,
there's no way you could have a suit.
That's so funny.
And so he goes, come on in, and then he interviewed, and then I started really wanting the fellowship, like really badly. And he's like, okay, I'll let you know my decision. And I was like, your decision? Why is there a decision? You got me all emotionally involved in this, and now you have to think about it. Like, I feel like I've dated girls like this.
So funny, dude. That is so funny. Oh my God.
And fortunately, I got the fellowship, and he's still to this day, his wife, Christine, is super smart.
That is
used
so
to work with
funny,
Bill
dude.
Gates. And he looked at Christine. He really trusts her opinion. He said, well, which one should I take? And she said, I like the guy with no socks. that's so, okay. So long story long, I get this fellowship. And he goes, okay, you got the fellowship. I go, okay, great. That's amazing. And he goes, you should really apply to a plastics residency.
Oh, wow.
And I was like, I wasn't even planning on doing an extra year. Now you're talking another 4 years. And I go, I don't know. And he goes, Kurt, he said, there's no one that's done plastics, reconstructive urology and urology that treats the trans community. Do you want to be the best in the world at this? And I was like, well, I've never really had an opportunity.
I don't have a letter of recommendation for this one.
Yeah. I'm like,
But can you
good
guys
at ping pong.
listen this best in the world?
Yeah.
Not like just like Austin or
And when you think
not
about
the country, the world.
that, and when you think about it, so when
do you understand that?
I know you got to understand. You have to, because of colleagues and people that you've worked with and whatnot. When you think of somebody in the prestige of being able to have a title anywhere near that, right? And have the credentials to back it up and have all the letters, the MDs, and all these different credentials behind it. You don't picture someone like you who's so chill and laid back. No. I know you know what I'm saying when I say it, right? You picture someone who's very uptight, who's very this and that, who's kind of a tight ass. You're like really cool. You're really relaxed.
Thank
I'm
you.
serious. And I know you have plenty of colleagues that are tight asses and whatnot, right? So that is super cool that you have been able to go down this path on your own terms, essentially. You've had a path and all this stuff, but you've been your own guy and you've been done it the way you wanted to do it. And it's fucking legit. That's what's up.
Well, thank you. I appreciate it. I do want to point out, like, it's not like I was in the best neurosurgeon in the world, right? I wasn't like the best quarterback in the world. It was 2000 at this point, 6 or 7, and I was embarking on something that at that time no one knew about or wanted to do. And so if you are doing something that is relatively unknown, you can quickly become one of the best in the world at it, because it's kind of like curling. Like, you watch curling on the Olympics.
I try not to.
You try not to.
No.
Like, sorry, all the curling Olympians. I'm going to rip on you for a moment.
All the curling subscribers we have right now.
Yeah, it's like, okay, you went to the Olympics, but it's in curling. Like, congratulations. Who wants to do that anyway? And yes, you're an
That's so
Olympian,
funny,
and no one can take that away from you. But
It's curling.
It's
curling.
It's not in ski jumping.
Yeah.
It's in curling.
They're not the athletes you expect to see during the Olympics.
They are. It looks like they pulled them from the stadium. You're like, oh, this is the amateur.
But think of, what's so great is that you being one of the pioneers, call it what it is, right? One of the pioneers to, reassignment types of procedures and reconstructions and whatnot. You're that much further ahead not just because it's something you do, it's something you're passionate about, something you really give a fuck about. And that's what makes it so cool, because you really care about this.
Yeah,
right?
exactly. You can tell, like, the people that you're helping out that you give a shit about, and that's so rare.
Thank you.
And it's life changing for them.
Yeah.
And this, it's easy to get desensitized by repetition, seeing the patient. If you're a podiatrist, or if you're an orthopedic traumatologist, or if you're whatever, a hand surgeon. But it becomes repetitive to where I don't care who you are. It's easy to get desensitized. But something like this, where I'm certain you've seen people cry. Your patients bawling because of how much you've
I'm
changed
like,
their lives.
can you imagine
Yeah.
being that person, meeting him?
Yeah.
Like that has to be.
Well,
No,
being tormented.
Oh no, I think it's
Crying
probably
after
so
they met you, like, what the fuck?
comforting.
comforting. They think they have won the lottery
that's what
when
I would
they
think.
meet you.
Well,
Sure.
and the thing is, before now, it was just even. Let's just take the transgender part out of it. People coming out as gay, that was such a hard thing for them, right? And other people would look at someone who's not gay, they would look at someone who's gay and say, like, I don't understand. It should be black and white. And to a person who's dealing with that, that's very real for them. So that's just how they're born, and that's a real deal that they deal with. But I think going a step further into, really feeling if you're born a man or however that this is how I'm supposed to be. I mean, I can't imagine the torment that they're dealing with internally because of outside sources of people and what are they going to say, and then getting the opportunity to meet someone like you who is really taking it to heart and saying, I can help you.
And you can feel it.
thank
He feels this way. It's
Right.
so
Yes.
unbelievable. That's what happened last night when he was explaining it. And I feel like I am a good example of someone that is, I'm not in the medical industry.
field.
Thank you. I'm just a normal person, and I am
I'm just a normal
not,
person.
You're not
just.
normal.
Yes,
Well,
I'm
There's not
But
much
I-
normal about you.
I don't-
In a good way. In a good way, for sure.
But I'm trying to not ever be judgmental towards people. I'm trying to accept everyone for
Yeah,
who
you
they
want to
are.
understand.
But I'm going to be honest with that I haven't understood a lot of these things. And the things I haven't understood the most is when children are in certain families, for instance, maybe they're in a situation where they are, I don't know, with two dads, two moms, whatever, will that influence their decision? And it confused me until last night because Curtis then explained to me that really their situation, what they're in, that's basically their path. And whatever their path is, and now that they are this person, the only thing left to do is be compassionate.
So,
And I was like, whoa. I've never thought about that in my entire life, to think about it that way, that I can't change that person's path because they're in that situation. Do you know what I mean?
sure.
And to understand that that's their path, that's what they're in, and now the only thing left is to be compassionate. Mind blown. My life has forever changed.
And there was
Forever changed.
Y'all
I'm
said-
not kidding.
y'all said two things earlier that I was like, all right. When y'all were talking about who you were going to have on, I was like, yeah, I'm going to like this guest. One was that he completely changed your mind about something.
Completely.
Yeah, and that's crazy. But then the other one was, if it had been 2:00 in the morning, we would have kept listening to it. And I was like, oh, that's awesome. Like that's
I mean, if Patrick didn't, I was kind of mad at him. I was like, why did you stand up and end this thing? I mean,
What
they
happened?
said,
Well,
we
they
talked-
said that Curtis was speaking and that nobody said a word for like 2 hours because
of what?
Oh, last night at dinner?
Yes.
I was like,
at
wait,
our
just now?
house.
What? Yeah.
It was unbelievable. And I feel like a changed person. I know this sounds, maybe you're going, oh, she's only saying that because I'm sitting here. I'm not. I promise you. This is for real.
well, leading into that, then before we like go into anything else, what is something that you would say to people who do have a hard time like understanding what you do or why people want to do that? Because yes, it's more talked about, but I feel like this topic is
That's good.
still very judged by people,
For sure.
or they don't understand at all. Because I feel like if you come out as gay or lesbian, whatever, people are like, meh, whatever. I think this topic though, and then you have the topic of younger people.
Yeah.
And I will say that I didn't understand the young kids. I said that I was concerned only because I was like, well, when I was little, I wanted to be an astronaut. And then you change your mind. So I was like, well, what if they change their mind? Or what if the younger ones, not adults?
I asked him that last night.
So what, maybe explain
Mhm. Please.
to people who don't know.
Yeah, sure. In your first question, what do you say to people that are sort of not feeling this, and that happens? The number one thing that I think everyone should do, and what will help the trans community be accepted for who they are, is just preaching respect.
Mm-hmm.
And I feel like part of respect is respecting people when they disagree with you.
For
and
sure.
so
Absolutely.
I actually don't really try to change people's minds.
Mhm.
I'll educate them. I'll answer their questions. But if someone's like, I don't believe in that, I'm like, okay.
Okay.
You know,
Right.
do
Exactly.
you want to play pickleball? You know, you're not you're not gonna like people have a deep-seated belief system that's based on their entire life experience,
Mhm.
their religious background,
Mhm.
their parents' teaching,
Absolutely, yes.
and to think that you're going to change anyone's opinion in the amount of time I'm standing there in the elevator with them or something,
Yeah.
like it's insane. And you see people arguing on Facebook.
Right.
Never once have I seen someone go, now that you put it that way, I'm gonna vote Democrat.
Right, right,
Like
right.
no one changes their mind. It's
Right.
just self-promotion and arguing.
Yeah.
And so I don't, if someone comes to me and says, change my mind, which has never happened once, then let's take the time to think. Usually it's just someone that wants to argue. But what I will say to them, very simple, is, everyone deserves a chance to be who they really are.
I agree.
That's it.
Yeah.
It's that simple. It's super basic.
Mm-hmm.
And if you keep it basic and just give them one little thing to think about, then maybe someday, weeks, months, years later, they'll be sitting there getting a haircut and go, everyone does get a chance, but you're not going to change their mind.
Yeah.
That encounter.
For the passionate, I think I more just want to understand, we don't judge anybody. I just am wanting to understand more because it has to be a lot going on internally, which
Yeah.
it makes me. I don't want anyone ever to hurt, obviously, but it's just kind of understanding. I wouldn't, because they say you can never win an argument anyway, so you don't have to argue it. But I think you can try to learn or understand people, and there are those people. Like I want to learn and understand to be more compassionate for them in any way, because sometimes what you see, you don't know anything but that. So you see aggressive behavior from people like, well, I want to do this, the people who are changing.
Mhm.
So you're like, well, I wonder what's going on or how that all works or anything like that, or the age of people.
Yeah, we can talk about that. That's probably one of the more controversial things with healthcare providers treating the trans community as well. What do you do if someone's less than 18? And we talked.
That was literally going to be my question.
He
Like,
is.
Yeah.
It's the most amazing
Yeah.
explanation.
What is that?
Thank
wait.
you.
Just wait.
Yeah, I think we probably talked about this for like an hour last night. And you brought up the example. Well, you wanted to be an astronaut, and maybe right now that's not looking like it's going to be in the cards.
Right? No,
Right.
not at all.
Oh, you can still do it. Don't listen.
Yeah,
Don't listen to him. You can still do it.
I haven't totally
do it.
ruled it out,
I don't want to
Marcella.
go.
You might.
I'm too claustrophobic. I can't get in the thing.
But imagine dancing in zero gravity. I think you'd be excellent.
Ooh, that'd
at
be
it.
cool.
Well, see, so
Shit, I want to
Oh,
try that.
nice.
Maybe-
I want to
do
try
wanna
that
go
out. That's
space.
good stuff.
yeah, maybe it's
It's possible.
something to think about
Yeah.
again. Yeah. But okay, so say you're 5 years old, right?
Mhm.
And we were talking about frontal lobe myelination and development last night. And you're usually in your early 20s when your frontal lobe finally develops. For me, it was around 43. And that is an area of higher cognitive thought.
Mhm.
And that's like, okay, problem solving. Like, what would my career be in the future? And that's why you have kids saying, I want to be.
Yeah.
I think when I was a kid, I literally wanted to be a train when I grew up.
Like
And my
literally.
mom's like, "You want to drive a train?" I'm like, "No,
No,
I want to be the train." Yeah, I
That's
remember
funny.
saying that.
I'm gonna be Thomas.
Yeah, exactly. I was like, well, Tom can talk, so why not? and so, yes, that's frontal lobe stuff. Your gender identity is not in your frontal lobe. It's a deeper part of the brain that's developed very early. And
I don't know that.
yeah, you don't know
Yeah.
that. And so the example, like, no matter what the haircut, you can tell the way a 4-year-old boy behaves compared to a 4-year-old girl. They play differently. They talk differently. Try to put a dress on a 5-year-old boy. They will lose their shit.
Mhm.
Yeah.
It doesn't happen. they know their gender identity.
Okay.
And then 6, 7, 8-year-old tell an 8-year-old boy to only play with dolls. Like, you run these experiments. They clearly know their gender identity. And there can be times where there's some confusion around that identity.
Mm-hmm.
That's why nothing permanent is done. Say there's a child that is having some confusion, maybe trans, maybe not. No one's rushing to operate on this person to make a decision that moment. You don't have to decide. Just let them live their life.
Right.
You know, if you have someone born with female anatomy, but he identifies as a boy and wants a short haircut and wants to wear boys' clothes, what's the harm?
Right.
Let him do that. And then if puberty hits and he comes out of it, no big deal.
Mm-hmm.
You know, at then her wedding, you look back at pictures when she used to want a short haircut.
Right.
Big damn deal.
Bring you that chili bowl.
Right? Yeah, that's it. And then, you know, we were talking last night, those against healthcare providers that are trying to help adolescents with any kind of gender confusion or gender incongruence, they've been marketing this term chemical castration to make it just sound evil as hell. Like someone decided to go to medical school, did a residency, did all this training because they are diabolical and just wanted to mess up a bunch of kids. Like literally. I mean, like it's insane. So they come up with this term chemical castration. It's the most evil term you can think of.
Propaganda.
Chemical. It makes you think of like DuPont using chemicals, and then people got cancer, and chemicals are harmful, and all this stuff. So you got chemical and then castration. Castration is a surgical technique to remove someone's testicles permanently, forever. They're gone. Neither of those terms are true. They're puberty blockers. We put patients on puberty blockers because going through puberty is really difficult. Going through puberty of the wrong gender is probably 10 to 1,000 times worse than anyone else's puberty.
Wow.
So you block puberty. And guess what? It's reversible. If it turns out this is not the thing, then you take it away and everything's back to normal.
Wow.
So unlike castration, which is a permanent surgical technique, puberty blockers are reversible.
Okay.
So it's inaccurate. It's a marketing term used to bias people against helping people in need that are suffering, that are trying to figure it out.
Yeah.
And I will be the first to say that the majority of patients that are prepubescent and have some kind of gender incongruence grow out of it.
Really?
Yeah, the majority do. I think it's like 20%.
That makes total sense for sure.
And that's why
Wow.
there's not a surgeon running around signing kids up for surgery. Now, that doesn't mean there aren't times we operate on adolescents. And I can give you a great example. And by the way, we discussed last night, you know, everyone wants this age of 18, the age of majority, the legal age in the U.S. Well, we talked about last night, that's the government making a decision for you when you're allowed to make a decision for yourself.
Yeah.
That's crap. The government used to throw people in jail for weed, and now it's becoming legal everywhere. That was the government deciding morality for us.
Yep.
The government in Europe thinks people mature faster in Europe. Their legal age is 16.
Wow.
So what I'm pointing out is it's arbitrary.
Yep.
It's totally arbitrary. And I prefer, instead of having the government decide arbitrary rules for me, to take each patient on a case-by-case basis.
Right.
So the patient I discussed last night was a patient that in preschool, and this is a true story, in preschool, this is my youngest chest masculizing surgery ever. The patient was 12. Okay. And you hear that and you cringe. And one of the reasons why you cringe is because like 12-year-olds have surgery. There's 12-year-olds that break their leg and they need a plate or need their appendix out. No one cares about that. People don't like to think about 12-year-olds and their genitalia.
No.
That's a big faux pas. But it's not about genitalia. It's about the well-being of the child.
Right.
Like, remove the genital aspect of it. And by the way, it's a chest surgery. It's for breasts. And some people feel like breasts are part of the whole genitalia package. Some people don't. So whatever side of the fence you're on that. So 5 years old, boys line up over here, girls line up over here. This patient born with female anatomy was always lining up in the boys line. And the parents are like, why are you screwing around at school? You got to line up in the girls line. Kid is like, it's because I'm a boy. And they're not like online Googling the trans community.
True.
Yep.
They're so young. Yeah,
they know.
They're just identifying. They're feeling it.
They're feeling it. They're doing what feels natural. And so they're like, well, okay. It's a really open-minded family, really educated. And they said, okay, cut your hair however you want, wear whatever clothes you want. What kind of nickname do you want? It's cool. So kid does great, has a bunch of male friends, really displays male child behavior. And then and gets A's in school, smart kid.
Yeah.
And then puberty hits. And unfortunately, this patient very quickly developed large pendulous breasts.
Yeah.
And went from this happy little boy to withdrawing, refuse to dress for PE, refuse to play with his friends, grades plummeted, put newspapers up on all the mirrors in the bathrooms that he would shower in, so that when he got out of the shower, he could only see neck up, did not want to see what was growing on his chest, could not see it, was contemplating suicide.
Wow.
So you know, I don't have kids, but I can imagine as a parent, the worst thing ever is seeing your child suffer.
Yeah.
Oh, yes.
And so both parents come in, they've got this 12-year-old that's pretty mature for his age because he's had to deal with some shit.
Yeah.
Pleading with me, help my child not commit suicide. Everything was fine.
Jesus.
Yeah.
Like emotional.
It's awful. Everything was great until these breasts showed up.
Wow.
And we need to do something because he's not going to make it much longer.
Wow.
And then, following the WPATH guidelines, World Professional Association of Transgender Health, 2 letters of recommendation from 2 different mental health therapists saying, yes, it would be cruel to make this patient wait 6 more years to be 18. So at that point, I'm a medical provider. I have the option of going, well, government says 18, so call me in 6 years. We're doing what's right, helping the parents and helping the kid out. And so it's crystal clear to me.
Yeah.
And anyone that has issue with this needs to come to my clinic.
Yeah.
They're welcome to.
Yeah.
They can come and see this. It's for a lot of people, they empathize by putting themselves in someone else's shoes. That's why humans empathize.
Right.
And so it's easy to empathize with someone that's been in a car accident or that's sick, or, most of us unfortunately have known someone that has had cancer. And so we can empathize with those things.
Absolutely.
It's impossible to empathize in that way with the trans community. I've taken care of thousands of trans patients this time. My practice has. And I have no idea what it's like to be trans.
Right.
We can't use our typical methods of empathy to feel for these patients. So I'm asking, acknowledge the suffering, and I'm saying I'm gonna help where I can. And people that if it doesn't align with their belief system, it's just a lot easier to go, no, I don't believe in it.
Right.
Than to understand that this suffering's going on. And they flippantly say, I don't believe in it, because they can't picture it.
Right.
Well, I can't picture it either, but I sure as shit know it exists.
Right.
I see it in my office every week.
Curtis, what happened to this patient? How old is he today?
He is he's finishing up college.
No way.
I get letters occasionally from the parents. Finishing up college, has a girlfriend, did great, just
Wow.
flourishing. You know, the way
awesome.
the way he should be.
Yeah.
And at one point, he was suicidal at 12 years old, and his mental health providers, his parents, and me don't think he would have made it until 18. So,
Wow.
That's incredible.
So on a situation like that, so you do the procedure, it's done 12, 13 years old, right? Everybody's on board with it.
right.
So as he ages, you know, is there more reconstruction to come about for building the pec muscles to be more natural? Or, I mean, I don't know anything, so it's a legitimate question I'm asking.
No, it's a great question. And the answer is not at all.
Yeah.
You do one chest surgery, and then he's on puberty blockers.
Mhm.
He gets on cross-sex hormones. He's on testosterone because he's a trans man.
Yep.
And he hits the gym. He can look great.
Yeah.
He can look like you.
Yeah.
Yeah.
What about his bottom? Like,
Yeah, no,
The
I was
penis.
pulling like the penis.
Oh,
Like,
yeah,
can you
yeah. Well, yeah, he
reconstruct,
has a
like,
vagina. Sure.
Yeah, but is there down the road? I mean, there's obviously the strap-ons and all this stuff, but is there in the foreseeable future like the ability to put a penis on a trans man?
Oh, yeah,
no,
we're doing
that's
it.
what he's doing.
No, but there is now, so you guys can
Yeah,
construct a penis.
My
and
practice
everything?
has done 800.
No shit.
Yeah,
So-
we're probably second most in the world.
So tell me
I
about
want
that.
you to know before you get into that. When I was researching for the show today, I was learning so many things, and one of the things I learned is that is rather new, and that some transgender people had been told it's easier to make a hole than a pole.
Well, that's what I would have thought. So how does that go
I
about?
was like, whoa.
Well, it's true. Let's see. Sorry, I built a vagina yesterday, and it took like 2.5 hours, and it looks good.
So now can you actually, so
versus-
when you're building a vagina, when you're reconstructing, and I have this page here with like 30, 40 vaginas. I mean, so you can go in and create a canal and
Right.
the same nerve endings so that they can still feel sex as good as, I mean, is it just as good? Are they feeling the same abilities? Can they have an orgasm and everything?
Yeah, they can definitely have an orgasm. They text me at 3 a.m. telling me.
Fucking thank you.
Yeah,
Thank you so much.
I just had
No
my
way.
first female orgasm. Thank you so much, Dr. Crane. And I'm like,
No
Oh my
way.
God.
That's legit.
It's gotta be so awesome.
yeah,
That's
well,
legit.
it's awesome to a point. I'm like, can you have your
Stop
orgasms
having sex.
during business hours? And
That's so funny.
I'm so amazed by
Yeah.
all. I mean, these are things that people do not know, and I don't even know where you find out how to know those things, or you would wonder.
But you find out right here on
Well,
the
I
Two
know.
Posh podcast. With
But you
Dr.
wonder,
Posh.
yeah, if you are a male or a female wanting to be a male, and then you know that you can give them a penis, correct?
Mhm. Yes.
And then how do you orgasm? Like, do they come? Do they have like anything come
Can
out
they
of
shoot?
it?
Can they like squirt? Can they do all this stuff? Like, how does that? I mean, do they have the ability to do that? Because
Yeah.
obviously, as men, we ejaculate.
Right.
Can they ejaculate? You know, can
I'm so curious.
I am too. Truly curious. Can you make it to where they have the ability to ejaculate too?
That's very difficult. A female to male patient that gets a phalloplasty,
What is it called?
phalloplasty. Like
Phalloplasty.
phallus
Yeah.
is like penis, and then plasty is just like making stuff.
Phalloplasty. Okay. All right.
Yeah. Yeah, like abdominoplasty.
Yeah.
It's like a tummy tuck.
Yeah, absolutely.
Yeah.
Rhinoplasty, nose job, all
Exactly.
that stuff.
Yeah.
The plastic.
No, they can have an orgasm, but it'd be a relatively dry one.
Okay.
Nothing
Okay.
would come out. But Marcella, easier cleanup.
Well,
There's pros and cons to this.
trust me,
right? Like
That
you don't
is
even need an
so
IUD.
No.
It's gonna be
funny.
cool.
you're fine.
Oh my
yeah.
God, that's so
Nobody's
awesome.
gonna get pregnant.
There's
It's totally fine.
lubricants. There's all
Nobody's
sorts
gonna
of
get
stuff.
pregnant.
Yeah.